Hello and welcome to Asaki Online. The program is on the Frontline, where we look at COVID-19 and other related issues. My name is Nozipho Majola. On today's program on the Frontline, we speak to a doctor and get more perspective on the COVID-19 pandemic and all other happenings around this pandemic, so that he can shed some more light on issues that we may not understand. We speak to Doctor Rogers from Afrimom Pregnacy. Good morning, Doctor. How are you?
Good morning, Nozipho. I'm good. Hope you are good as well.
Great. Welcome to the program.
Thank you. Thank you.
Briefly, let us know, what does Afrimom Pregnacy do before we get into the intricacies of the program?
Thank you. So Afrimom Pregnacy is a health startup that mainly is concerned about giving African women a safe, smooth pregnancy experience. We are developing an application called Afrimom, which will soon be shared and available on Google Play Store as well as on App Store, which we think will go a long way in helping pregnant women through their pregnancies.
Okay.
Yes.
Interesting. Let's get right into the program. We'd want to know that recoveries have been really going up in the country, a good sign indeed, and the rate currently sitting at 76%. Does this mean that we're winning the fight against COVID-19 as a country?
I would say that our COVID-19 rate, if you say it's around 76%, it's almost the same with recovery rates. Looking at different countries, probably I can cite South Africa. Their recovery rate is currently at 80%. If you look at India, it's around 78%. Africa as a whole, our recovery rate is just above 72%. So if ours is at 76, it's just in the average range. So compared to others or relative to other countries, we are not doing either very good or very bad. We are just there. And probably it's good for us as a country, given that we are going through some hard times in terms of health system. I think it's pretty much good to know that we are just in the same bracket with many other countries.
So what determines that someone has fully recovered from COVID-19?
Probably we might start with saying what says that someone has COVID-19. So first of all is the symptoms, right? When someone has a cough, has a fever, and there's so many other symptoms, we might then suspect that this person might be having COVID-19. And so when they recover as well, we are looking at the symptoms. Have those symptoms gone away? Are they well now? Are they breathing well? Are they not coughing? Is their fever resolved? But much more importantly, again, is how we confirm whether you have COVID. We do a test, which you call a DNA PCR, to confirm if you actually have the virus in your body. And when you say you have recovered now, outside the symptoms and the other signs that we talk about, we also talk about the presence of the virus in your body. So we do what we call the COVID-19 DNA PCR test. And if that is negative, then we know that you are now free from COVID-19.
Is it possible to recontract the virus again?
It's actually a common thing. Recontracting is very common. Although what might be different is how your body reacts to the COVID-19. Initially, when you get it for the first time, remember this is a new thing to your body. It has never had your immune system has never had an encounter with the virus. So it's a surprise, and it's a surprise foreigner in your body. And your body might deal with it differently when you have it for the second time, because you now develop what we call antibodies, which are readily released when you have it for the second time. So recontraction is common. You are not immune to getting COVID-19 if you get it for the first time. You can always have it maybe again and again if you continually get yourself exposed to it.
Is it safe to say or assume that the second time around, when you contract it again, your chances are high of surviving it? People do say that, so we just want to know and demystify it if it's a myth.
What I would say is, yes, when you get it for the first time, you are at a better, you are better prepared to fight COVID-19 because, as I said, your immune system is now empowered to fight it off. But there are many other factors that determine recovery to COVID-19. We talk of what we call the viral load. If your viral load is high, or if you've been exposed to too much of COVID, and the levels in your body are a bit very much high, then you might actually succumb to it, even if you have had it before. And if actually your recovery is also determined by your state of the immune system. So if you get it for the second time and you are sick from other things, say if you are having a bad, maybe a diabetic and your sugars are not well controlled, it means then when you get it for the second time, your immune system is weaker. So all things being constant and without any changes in your body, when you get it for the second time, the experience will be better in the recovery. But but as I've said, circumstances always change. You might get a higher viral load the second time, or you might be sick from other things. So you might actually succumb even if you had had it earlier before.
What kind of treatment is normally used by COVID-19 patients? People at home are practicing so many home remedies. You have lemon, you have garlic, you have ginger, some are using gum tree. What treatment is used, and are these remedies helpful perhaps towards fighting COVID-19?
Thank you for using the right word, which is treatment, because as yet we haven't developed a cure for COVID-19. So all that we are using doesn't cure, it just treats or helps the body to do away with COVID-19. So in a clinical setup, or what we as the conventional health system, what would give you, we give you nutritional supplements, vitamin C, vitamin D, and also zinc. And we give you probably some antibiotics, erythromycin, to help you recover. And then we support also your breathing. If you are in a state where you now need respiratory support and you are struggling to breathe, then we help you with breathing. This is how we are treating COVID-19. As for the home remedies now, what we know is, if you look at most of them, the concoctions that we are talking about, lemons, gum trees, and all eucalyptus, they, especially the lemons, they are also just good sources of these nutrients that we are talking about, the vitamins and also other mineral ions that are very important for the body to mount an immune reaction to fight off an infection. So what I would say is the home remedies, they do work to treat, but my advice is that whenever you feel like you need treatment or when you are COVID positive, make sure that you have a health personnel who is trained helping you out. You might actually do vitamin C and your home concoctions is fine. Where I have problems with home concoctions is someone who just wants to use them without any clinical consult or talking to a doctor. And then fully putting their hope in them without getting assistance from someone who actually knows. At the end of the day, you might not get a good outcome. So as much as we use them, let's also get professional input from people who have trained in this in the medical field. Then secondly, of course, somehow as people, or maybe as Africans, we always feel that the bitter a concoction is, the more powerful and stronger it is, in helping in your recover. So we tend to try to mix everything and look for the most awful route to put in our concoctions. The danger sometimes is I feel that, I always call kidneys in our body poor kidneys, because at the end of the day, they encounter everything you put in your body. Somehow it ends at the kidneys. And sometimes you might actually damage them with very dangerous stuff that we are taking from different roots and leaves that maybe not, that might actually be toxic and poisonous. So my advice is, let's keep it simple. Let's keep it simple. Let's try our citrus fruits. Let's try our green leafy vegetables. Let's try our balanced diet to go a long way in helping our bodies fight off COVID-19.
Okay. We have already spoken about what to take when fighting COVID-19, but is there something we can take prior to, maybe, is there immune boosters in terms of COVID-19, or that doesn't work? Because people have the habit of doing these concoctions, the bitter, they are the garlics, before in the morning when they wake up, in the evening when they sleep. Does this help in terms of trying maybe to avoid catching on the virus or anything like that?
The determined or the known ways of preventing ourselves from COVID-19 are what we are always teaching in the radios and televisions. Wear your mask, avoid touching your face unnecessarily, social distance, stay at home if you don't have anything to do outside, always wash your hands. This is what will prevent us from COVID-19, not the foods that we want to eat or the nutritional supplements that we want to take. So my take is those things will just make our immune systems probably better, but they will not prevent us from getting COVID-19.
There are World Health Organization guidelines, and speaking of some of those, part of those guidelines say that someone can go home after day 10 of isolation. Does this mean that the virus is no longer active after that period, and we can transmit it from one person to other at the time?
There is what we call natural cycles of diseases. For example, if you catch a flu, you know that for the next probably 5 to 7 days, the natural cycle of flu is 7 days. Without any intervention, you will be sick for 7 days. COVID-19 is also its natural cycle. And when it came, we had put it at something like, if you have no other disease and you catch COVID-19, you're probably going to have the experience for 2 weeks. And if you have some other serious problems, like maybe you have cancers or you're diabetic, it might take you longer to recover, maybe 3 to 6 weeks. So right now what's happening is, remember, the virus is novel and research is going on, and we are finding out new things. So what the World Health Organization is doing is they are reviewing, and they are finding out probably that if you do a repeat test probably earlier than 2 weeks, we find that you are now negative of COVID-19. Probably that's where the recommendation came from, to reduce the isolation days and so forth from 14 days to 10 days and all that. And also remember facilities that we have, isolation, quarantine, facilities, all those things. We factor in everything, and then we try to come up with a public health recommendation that will be that might actually be suitable for our circumstances. So after 10 days, it doesn't mean that we are saying COVID will stay in your body for 10 days and it goes. The normal thing is after your 10 days, you should then get a COVID test to actually prove that you are now free of COVID, and then you can go home. So this is what should actually be done. It doesn't mean that after 10 days it goes, because you can actually have a reinfection while you are trying to recover, and so forth. So it doesn't mean it's gone. It means it's days where we think it might have gone, and we need to test you to prove that you don't have it anymore.
Okay. So generally COVID-19 is said to affect the elderly people the most. But in Zimbabwe, some of the cases are between the ages 20 and 40. And so what could be the reasons for this?
I wouldn't dispute that COVID is more common in the elderly. And this is true in with other statistics when we look at other countries, the US and so forth. But let's come home, closer home, and see what we have been doing. Who has been testing for COVID-19? If you look at it, it's people who are testing because they have to go back to work and they need a COVID certificate to prove that they are free of COVID. And these people are generally in the age range that you are talking about, 20 to 40. And the elderly people are just there at home, locked in the houses, and they are not getting tested. So what we'll have now is we just have more positive people, more numbers of the people we are testing, that is 20 to 40. So I think that explains a lot why Zimbabwe actually have that age group is the one that is more affected or more positive than the older age group.
Okay. On the issue of dates, the COVID-19 dates, what exactly is driving this?
The first thing is COVID-19 is a virus; it will kill you. So the first driver is it's pathological. But probably the second thing is probably what you are asking is what makes you more susceptible to COVID-19? And the answer will be the first thing is age. Older people tend to be affected more by COVID-19 and they die more. Probably the reason is as you grow older, you have so many changes and even your immune system is not as its best than it was when you're younger. Then the second thing, of course, is what we would call comorbid conditions. Conditions like diabetes, hypertension, cancers. These are drivers that will make you succumb. HIV and AIDS, immunosuppressive conditions, or any disease that makes your immune system weaker. These will make you get more affected by COVID-19, and you actually more people with comorbid conditions are dying than those that just have COVID with nothing else. So the main driver is comorbid condition and also age as well. And of course, coming closer home, you will then realize that with our economic situation and with the way that people's health-seeking behavior of people, with our health system, which is not at its best, you would realize that most people with diabetes, hypertension are not well. They are not controlling those conditions well. So when COVID-19 sets in, they find a person who is already struggling with diabetes and it will push, that will just make them succumb to it more.
Yeah. Okay. Where do these deaths occur? Is it in isolation centers, at home, in treatment facilities, in hospitals?
Eventually, people die in hospitals. But death is a process, right? And people just they start dying at home. While they don't want to go to hospital, they know they are sick, and they don't move an inch. They believe, especially our Zimbabwean men, they have this macho man mentality where they believe they are masculine and very strong and they will fight off infection. And people just generally hate the hospital. So people start dying at home and the process just ends in hospitals. So most of our deaths are actually institutional. But you realize that when people get to the institutions at the end of the day, most of the times there's nothing much that you can do to actually assist them.
Talking of the vaccine, we know there isn't any treatment or any cure yet, that's the word, for COVID-19. Any talks of the vaccine coming through to our side of the hemisphere, perhaps?
What I just know is so far, Russia, the US, I think China, and probably other European countries, they've rolled out the vaccine. But there are still issues around the vaccine. There is a normal way that vaccines are developed. They are tested, they are found to be efficient, they are developed, developmental stages of vaccines, which because of how COVID has hit us, we are trying to fast track the process, cut corners, and even though the vaccines have been rolled out in those other countries that are pace setters in terms of health delivery, there is still a lot of skepticism on whether the vaccines actually will work or actually do work. So it might then take us time to actually eventually accept the vaccines and also get them this side of the world. I can't really say when and how and whether it will pay or not. I'm not conversant with how things are going to be, but given that the World Organization is in this thing and this thing is affecting the whole world, the hope is we can get a vaccine which might be affordable for every country, including poor Zimbabwe as well.
What is contact tracing, and are we being effective at it in terms of us maybe fighting the COVID-19 pandemic?
Contact tracing is saying Nozi is COVID positive, but who has been a contact? Who has she been? Who has she met in the past maybe week or so? That's contact tracing. We find those people, also test them, and we quarantine them so that they do not spread COVID-19. That's contact tracing, which is a good thing, because in other countries it actually worked well. For China, they had a very strong contact tracing system, which actually helped them combat the spread in such an amazing way. But locally, our efficiency is really pinned, because we need resources to do this. We need manpower, we need vehicles, we need test kits. It's a lot that is needed for us to do contact tracing. And we haven't been efficient because the systems that we have set up have quite been overwhelmed to actually do proper contact tracing. So we are not doing well on that side, and hence this is how we are having so much cases coming up. To all women out there who are pregnant, I like to tell them and encourage them that they should not miss their antenatal care visits, as this is very important to a successful pregnancy experience. We believe that no woman should die while he's giving birth, while he's trying to give life. And this starts at how the mothers take care of themselves from the first week of pregnancy up to the last week of pregnancy. And one very important thing is them having their antenatal care visits, having proper tests done, being scanned, getting the right medications if they have other conditions, getting their folic acid and iron supplements. So to every pregnant woman out there, or any woman who's planning to get pregnant in this COVID era, you still deserve to get standard and quality care. Go to your nearest clinic or healthcare facility, book your pregnancy, have necessary tests done on you, get yourself scanned, and keep your doctor's appointments. And do not panic. Do everything that you can to protect yourself from COVID-19, but do not panic. Many other women are having their babies right now, are safe. So can you, but only if you do the right thing and take the necessary steps to get help.
How can pregnant moms and expected moms and those that are planning to get pregnant this year or in the near future get in touch with Afrimom Pregnacy?
As I said, we are developing an application which will be out soon. So I would encourage all women out there to be on the lookout on Google Play Store for Afrimom application. And I can also share what we have is we've got peer-led subfertility or infertility groups. We've got nursing moms WhatsApp groups. We've got pregnant women WhatsApp groups where women meet and share their experiences and encourage each other, give others tips. So if they want to join our WhatsApp groups, I'll just give you my number so that we add them to our groups. And also, if they want to talk to any one of us, I also give you my number for any direction or anything that they might need help with in their pregnancy, so that they can get in touch with Afrimom Pregnacy.
Thank you, Dr. Magigo, for joining us on the program.
Thank you, Nozi. Are you yourself planning to be pregnant in this COVID era?
I am broody, yes, but I have to when I do, I'll let you know.
We'll be glad to help you as Afrimom to actually enjoy the pregnancy experience.
I look forward to it.
So that's all right.
Thank you so much for watching on the Frontline. Do share it on all of your social media platforms so that everyone can get to listen in on this very insightful conversation that we had with Dr. Magigo on the COVID-19 and what there is around it medically. Find us at Site ZW on YouTube.